My name's Shannon Nott. I'm the Chief Medical Officer for the Royal Flying Doctors Service South Eastern Section, overseeing care across New South Wales and ACT. I also have that dual responsibility of being the Executive General Manager of Health and Clinical Services. So it's not just looking over the medical services we provide, but much broader than that. By way of background, though, I'm a rural generalist doctor, so I provide a wide range of clinical services, so things from anaesthetics to emergency care to remote primary care in rural and remote areas. And prior to being with RFDS, I had the pleasure of working with New South Wales Health as their clinical director of the Virtual Care Accelerator, so being able to provide, I suppose, and support the virtual care response to COVID-19, and then transitioning into a statewide role as a medical advisor around virtual care strategy. Across in the RFDS environment now.
Yeah, look, I mean, and it's great to have you here at Digital Health Festival, and that makes a lot of sense in terms of the background. And I think about RFDS and I guess the communities that it serves, being those that are in areas that they couldn't otherwise access health services or to fly in to receive medical care. And when I think about the RFD, or when someone might think about the RFDS, think about the planes or the infrastructure, and that's like the focus. But it's interesting to see you at Digital Health Festival. Tell me a bit more about why you're here.
Yeah, look, I think naturally people think of it's usually due to the TV series about flying around in planes and the drama of all of that. But the reason why I'm here is that RFDS is intrinsically linked with technology, innovation, and looking at new ways of addressing some of our significant challenges for rural and remote healthcare. If you think about the whole premise of RFDS being born, the Reverend John Flynn, who was the founder of RFDS, actually sparked sort of enthusiasm following a tragic event where a stockman called Jimmy Darcy tragically passed away up in a remote part of the Kimberley. And it was following this sort of national attention where there were the disparities and geography and remoteness was front and centre for a lot of Australians. John Flynn was able to utilise that interest to be able to start getting our first planes up in the air, and being able to support rural and remote areas. It wasn't long after that, though, that they realised that they were only as good as the people being able to call for help. So very reactive. And if you think about the early 1920s when RFDS started getting planes up in the sky, a lot of rural and remote areas had no forms of communication. They weren't on telegram wires. And so people might have had to ride a horse hours away. And so Flynn worked with a gentleman called Alfred Traeger, a German engineer, to develop the first pedal radio so that communities suddenly had a voice, a way of being able to call for help, but also seek medical advice in community. And that sort of trend and premise of being able to provide the finest care to the furthest corner is part of that RFDS mantra, that mantle of safety that we have for rural and remote communities.
Wow, that's fascinating. And I know that you were up on a stage here at Digital Health Festival too. Tell me a bit more about that, because I think you were kicking things off, right?
Yeah. I was the lucky or unlucky guy that gets to kick off the first session in the virtual stage here at DHF.
Yeah.
You're always a bit concerned about whether people get away from the coffee or turn up to the conference in time. But it was great to see so many people from different sectors filling out that sort of area. And I think it's a testament to the fact that there are so many people with different walks and talks of life. There are technical people, there are data people, there's government, not-for-profit, business, private, small enterprise, large, coming together. And I think it showed that everybody was really interested in how do we actually change that dial. My talk focused around this aspect of equity, and that if we don't, as a collective health sector, if we don't work together around designing models of care supported by digitisation, by technology that meet patient outcomes or patient need, then we've failed across the sector. If we can't support programs that support our most vulnerable communities and vulnerable patients, then we've failed in all of this. Yeah. The whole point of coming together across the sector is to be able to innovate for the benefit of patient care.